Thinking about TRT in Australia? First, you need to understand what it will actually cost you. Forget what you've heard. The real annual price for TRT is between $2,000 and $2,600. You might think government help or private insurance would cover a lot of that. But a critical flaw in the system disqualifies most men with genuine symptoms from any aid. This is your full breakdown. We'll expose every cost and explain the system so you can decide. So where does that $2,600 figure come from? Let's begin with the consistent, ongoing expenses. Plan on paying between $170 and $300 every single month. This covers your medication, supplies, and monitoring. Before that, you have startup fees. The first specialist consult will run you $150 to $300. The next major charge is your blood work. Your initial detailed panel can cost up to $290 out of pocket. This isn't a simple T-check. Proper diagnosis needs to look at free T, estradiol, SHBG, and PSA. Cutting corners here is unsafe. And this cost is permanent. TRT is a lifelong therapy requiring $100–200 follow-up tests every 3 to 6 months. With all these required medical costs, you have to ask, why isn't the PBS helping pay for this? The answer is in the details. To get a subsidy, your testosterone must be at or below 6 nmol/L on 2 separate tests. Now, here is the most important part of this video. The medical line for low T symptoms is 8 to 12 nmol/L. The government's line is 6. This gap means you can have severe low T symptoms at a level of 7. Your doctor can agree you need treatment, but you get 0 subsidy. What about private health insurance? It's not the answer. Most policies won't cover TRT consults or medication from specialist clinics. This setup pushes men into the private market. Let's look at the costs you can expect to find there. Private telehealth clinics give fast access, letting you bypass the strict PBS rules. But this convenience is paid for entirely by you. So, to answer the question from before, the PBS isn't covering most men by design. This created the market that private clinics now fill. Be aware of their fee structures, big upfront program fees. Then the paraphernalia costs, needles, swabs, and syringes. It all adds to your bill. And watch for extra admin fees for script repeats, or just to have a doctor review your blood work. Now you see the costs, but what are you paying for? Let's compare the actual treatment options. In Australia, testosterone injections are the most common and effective TRT method. Small, frequent doses keep your hormone levels stable. Gels or patches seem easier, but many clinics find them less effective. They have absorption issues and can cause unstable T levels. Your treatment choice affects the price, but results are what matter. A cheaper but ineffective method wastes money and time. So we have high costs and restrictive government rules. How did the system end up like this? Remember that strict 6 nmol/L PBS rule? That line in the sand was drawn in 2015 when the criteria were intentionally made much tighter. But here's the twist. Tightening the rules didn't actually reduce the financial burden on the country's healthcare system. That 2015 policy change directly created the private clinic industry. By blocking public access, a new, more expensive private path was made. So the high price of TRT isn't some accident. It's the direct result of a policy made to shift the full financial weight onto your shoulders. To recap, you face costs over $2,000 a year, a PBS system designed to exclude you, and private insurance that offers little to no help. The main point is this. TRT is a serious, long-term financial obligation you will almost certainly fund completely by yourself. Your best protection is being informed. Demand transparent pricing. Ask about every potential fee. See if they offer flexible payment plans. You now know the complete cost of TRT in Australia. If this was helpful, share it with someone who needs this information.